So the McLeod Health Apprenticeship Program is a nursing assistant apprenticeship program that was developed back in 2017. With our model, we have two components, a youth apprenticeship and a traditional apprenticeship program with anyone over the age of 18. So with the registered apprenticeship, there are three main components: an educational component, on-the-job training component, and wage progression component. When it comes to the education component of a registered apprenticeship, Florence Darlington Technical College provides us the opportunity to send our students and future employees to the college to get the skills that they need to become certified nursing assistants. Not only does McLeod Health work with Florence Darlington Technical College, but we work with several other technical colleges to partner with Apprenticeship Carolina to develop and execute apprenticeship programs across all of our service areas. Apprenticeship Carolina works very closely with these schools to ensure that all three components of the apprenticeship are met so that when our participants complete a program, they receive a nationally accredited certificate through the United States Department of Labor. Now that certificate of completion will follow them for the rest of their life. With the youth apprenticeship program model, it allowed us to pull in high school students who wanted the opportunity to see if healthcare is really where they want to be, if nursing is really what they want to do. So if we have a high school student who is interested in becoming a nurse and they are accepted to the youth apprenticeship program, it allows them to not only come out with gainful employment as a certified nursing assistant, but to earn a livable wage at such a young age and explore those opportunities as working alongside a nurse to see if that's something that they really want to do, and to go to spend their time and go to school and get that RN registered nurse license. I think that we felt it was our duty to provide our high school students with that opportunity to see if it's something that they really want to do. And how cool is it that you can make a livable wage at such a young age and see if that's something that you really want to do.
I did the McLeod Youth Apprenticeship Program, and with that I had to be a high school student. I had to have a certain GPA and I had to have references. So I'm a certified nursing assistant. I'm like the right hand to a nurse. I go in and I take vital signs such as blood pressure, heart rate, respirations. And I also go in there, I do hourly checks on the patient. I make sure they're as comfortable as possible. I communicate with the parents, and I just keep the nurse updated throughout this entire process.
Well, when I was younger, my father had been in the hospital multiple times, and I've always seen the nurses, the nursing assistants, and what they did. It just fascinated me. It's something that I just knew right there, I want to do that. I want to try that out.
The apprenticeship program gave me the opportunity to get my nurse aide license at 16. Which is really good because some people, well, I know that they can't get theirs until they graduate high school and at 17.
You get to see how other people do their work, and there's different things that's not in the book, and you just really get to see everything and how it's like in real life.
I would recommend this program to other high school students that want to be in the medical field because it's a great way to have hands-on experience, also to see if this is really what you want to do in the future. I mean, college isn't that far away and you wouldn't want to waste all your parents' money, so it would be nice to see.
It was a great start with me being as young as I was. I was 17 years old in high school, my senior year, and I was able to get in a program that most people don't get until they're already out of high school in college. I was able to get ahead in all of my career goals. My director has had meetings with me to where I am pretty much guaranteed a job already as a registered nurse. They're also all willing on my floor and everywhere else I've been at McLeod, all willing to support me to get where I'm going.
So actually I worked here already as a transporter. My friend who actually had went through the program already had told me about it. So he told me how to apply. So I went on the McLeod website and applied for that apprenticeship program. I did classes at Florence Darlington Tech on the campus. And then we did about half the semester, it was like a whole semester long. So half the semester you did just textbooks, and after that you went into the clinicals, which was more hands-on, which was a lot more experience. And people that don't know about nursing, I really do recommend the program to them just because you get experience a lot, like what you're going to be going into as a nurse too.
Healthcare is so important because, we need people. Without healthcare, we wouldn't be saving people. And I always hear more nurses, and we honestly do. We need more nurses because without not even just nurses, it's the whole body of healthcare. We need more people because without people, how can we help?